Hi everybody and welcome back to my vlog. So this week I'm going to cover cervical screening, and I'm doing that because it's been in the press quite a bit over the last couple of weeks for very good reason, and it's a really important subject. So before we start, what is cervical screening? Well, it's a screening whereby every few years or so, and it depends on your age, we take some cells from the cervix of a woman and look at them under a microscope with the aim of preventing cancer. The cervix is the entrance to the womb. Every woman has one unless they've had a hysterectomy. And if you were to put your fingers in your vagina, at the top you can feel a round, soft, squidgy mass with a little dip in the centre, a bit like a donut, and that's your cervix. So that's what we're looking at to make sure that we can't find anything that means there's a cancer developing. So to start with, just some stats about cervical cancer. So there's a 1 in 142 chance of a woman getting cancer of the cervix, and that accounts for 2% of all female cancers. There are 3,200 new cases of cervical cancer diagnosed in the UK every year. So that's just over 9 women a day getting that news that they have a new cervical cancer. 870 women died in the UK in a year at the last count, so that's just over 2 women a day dying of this cancer, and that's why it's important. We don't want any women dying of any cancer. The really alarming news is that in the last 10 years the incidence of cervical cancer has increased by 5%. But even more alarming is the projection. So it's projected that between 2014 and 2035 there will be an increase of 43% of new cases of cervical cancer. So that's really alarming, especially as we now have some tools to try and prevent it ever happening. And this is why screening is ever important. So deaths to cervical cancer have dropped by 24% in the last decade, and that's the good news, and that's really because of screening, because we know that if we catch these cells early and in the windows between tests for cervical screening, if we catch any cells that are changing at any point in that time, it's early enough usually to treat them successfully. So the good news is that it's working, but at the moment women are going less often to have it. So that's really important, that we get the message out there that this is a completely preventable cancer, and screening helps do that. In actual fact, 99.8% of cervical cancers are caused by an infection, and that infection is human papillomavirus, or HPV, and 99.8% of those are preventable. And that's the key. But in order to do that, you need to go for your cervical screening. A really important figure is that 21% of cervical cancer cases are caused by smoking. And the reason for that is we know that most women, most of the time, will actually self-correct any cells on their cervix that are changing. So the body will actually take a hold and sort it out. But unfortunately, in women that smoke, that just doesn't seem to happen as well. So it's really important that you stop smoking, and not only because of this, but because it really wrecks your skin and causes wrinkles, because it starves your skin of oxygen. It causes cancer, it makes you look older, and what more can I say? I won't lecture you on that right now, perhaps that's a future vlog. Okay, so when does screening happen? Well, screening starts at the age of 25 and finishes at 65. So you will be called for your first cervical screen approximately 6 months before your 25th birthday. So if you haven't got that call, and it's a letter that comes to you in the post, and obviously young people move around a lot with uni and work, so quite often that letter goes astray. So if you haven't got that letter and you're coming up to your 25th birthday, speak to your GP and they can organise a smear for you. You will be on the database somewhere. Thereafter, after you're 25, you'll be called by post, so by a letter, every 3 years to have your screening done. Depending on the results, of course, but I'll talk about those later. Once you get to 49, we then only screen you every 5 years, because evidence shows us that's all that's needed. Because the biggest age bracket for new cases of cervical cancer is the 25 to 29-year-olds. So After the age of 50 up to 65 you'll be called every 5 years, and if you're 65 and over and you've had one abnormal test in the last 3 that you've had, you will be called again. Otherwise you'll never be called. Excuse me, frog in my throat. Otherwise you won't be called again after the age of 65. If you've had a hysterectomy and you no longer have a cervix, you won't be called at whatever age you've had that. If you've had a hysterectomy and your cervix is still there, you'll carry on having cervical screening as normal. So as a GP, I often ask people about their cervical screening and are they going to attend? And people say to me, no, because I'm a virgin or I've never been sexually active. So it's an important question to address. So essentially, if you've had any kind of sex, not just penetrative sex, so vaginal, oral, anal, you've had skin-to-skin contact with the genitals of another person, or you've shared sex toys with another person, whether male or female, you need to have cervical screening because HPV can be transmitted via those methods. It's not just penetrative sex. If you've never indulged in any of those things, never had any contact with another person, then you don't need to have cervical screening. You can though, no one's going to stop you, and so the choice is yours in those circumstances. So what's the process? This is probably the bit that scares people more than anything because they're embarrassed, they think it's going to hurt, they're shy, and all of those things are completely understandable. So I'm going to talk you through the process and then I'm going to talk you through some coping mechanisms, but it really isn't that bad at all. So as I've said, we take some samples of the cell from the cervix, so we have to be able to see the cervix to do that. So you'll be invited into the room with whoever's doing the test, a doctor, a nurse, or any other health practitioner who is actually screening women. It will take 10 minutes max. You'll be asked to step behind a screen after it's been explained to you and take off all your clothing, including knickers, from the waist down. You'll be asked if you want a chaperone, and you're entitled to have one, and that could be another healthcare professional wherever you are, or it could be a friend. The choice again is yours, or it could be just the person doing the test. You'll be asked to lie on the bed and you'll be given a small sheet to cover your genitals so that you're not just lying there and embarrassed about it. You'll be asked to bend your knees, bring your feet up flat and put them together, and then let your knees relax to the sides. Once that's done, the practitioner will open a speculum from a packet that's completely sterile and it will only be used on you once. Use some jelly on the speculum, which is a special tool designed to open the vagina to look at the cervix, and it will be inserted into your vagina very gently and smoothly with the gel. Once it's at the top of the vagina, the practitioner will open it up so that they can see the cervix. They will then insert a very soft plastic brush. They will stroke it around on the cervix. You won't feel this, it's not painful, this bit at all, on the cervix to collect some cells. Take that out and then gently remove the speculum. So that's it then, your bit in the whole process is done, and those cells will be put into liquid and they'll be sent off to a laboratory, and that's when they'll be looked at under a microscope to see whether or not there are any changes in cells that make them look different to how cells should look on the cervix. You could get a tiny bit of bleeding, some women do, just because the cervix can sometimes be delicate, but that doesn't mean it's going to be painful. So that's the whole process, and there's a very good organisation called Joe's Trust where I'm going to put a link to at the end, and they actually describe all of this process for you really nicely so that you can actually see what's going on. They also have some really good forums where you can talk to other women about it and discuss the process, so I will put a link to that at the end. Now if you are nervous, and most women are, I get nervous, and I went for a year or so when I didn't have my smear because I just didn't want to do it. And I tell you what made me go, I had to as a doctor certify the death of a 43-year-old woman from cervical cancer, and I just had a stern chat with myself and said, what are you doing? It's 10 minutes of embarrassment for saving my life. So I now always do my cervical screening. In fact, I must go now because I couldn't have mine because I was pregnant. So I will book mine now and go. So it's understandable, and the practitioner knows that. And Trust me, they're not embarrassed, they're not judging you, they're not looking at whether you've shaved today or whether you've got piercings or anything at all. They're just doing the procedure to help stop cervical cancer. But take someone with you if you're nervous. That's, it's always good to have some moral support. Or look at learning some breathing exercises so that you can relax beforehand and during the procedure. Tell the practitioner that you're nervous and what's worrying you so that they can reassure you and they can take it into account. If you don't like that position on your back with your knees up, tell them and ask them if there's another position that you could lie in. And there are other positions on your side, for example, so that you can't see the person who's doing the examination. You could wear your headphones and listen to music. You could read. Anything is acceptable. This is your test, your life, and we're happy to facilitate anything that helps get you through it. Don't forget to say to the person doing the test if it becomes uncomfortable. Just tell them. They can't feel your discomfort, so it's important that you alert them and they can actually maybe change things, pull back, slow down. So that's the test. I do have one tip for women who are over 40, usually, experiencing menopausal symptoms, or at any age who've had a premature ovarian failure, or who have had a surgical menopause. If you're finding that you have vaginal dryness that is making your cervical screening too painful and so you're not going, there's a really simple solution. So we often find that women have been coming for their cervical screening every 3 years without a problem and suddenly they stop, and it's quite often in their 40s. And when we speak to them and ask them why, it's because it's become too painful. So if that's you, please don't stop, but go and see your GP, explain what the problem is and ask them for vaginal estrogen for a month before. So if you apply vaginal estrogen for a month before the test, it will actually replenish your vaginal secretions and make it as it used to be. So make the screening comfortable, and then you can carry on doing it, and it's really important. So please do that. So what are we looking for once we've got those cells and they've gone to the lab and they're being looked at under a microscope? Well, as I've said, we're looking for any abnormalities at all in those cells, anything that makes them look different to how they should look. So we're also looking for human papillomavirus, so HPV. And depending on what we find, it depends on what we then do, where you go in the process and what happens and when you next come back. So those results come to you at home and they go to your GP, and they usually come within about 14 days. However, you may have seen on the news recently that those results are sometimes taking longer. And I really can't stress enough that if you haven't got your results within 2 weeks, chase them please, just in case they're not coming or they've got lost in the post or something like that. But please chase them. It should be within 2 weeks, but there are some delays at the moment. You'll be told what was tested, whether you were tested for HPV as well, and what was found. And you'll be told that your result is normal or abnormal. And then if it's abnormal, you'll go into one of various treatment pathways. So it'll either be no treatment and come back for another test in 3 years, come back for a test in 1 year, or be sent to colposcopy. And I'll explain colposcopy later. If it was normal, you'll just go into whether you were in the, depending on age, 3 years or 5 year testing. So just straight back to normal testing. Now, if you've got an abnormal result, that can mean many things. And it's always quite complex. So I'm going to put a list of these results at the end in the description, but to just talk them through with you now. The different results you might get are borderline or low-grade cell changes. And that's quite common, reasonably common. And you may get no human papillomavirus detected with that result, at which point you will just be told to go back into normal screening. So no treatment, back into normal screening. If, however, HPV was detected with those borderline or low-grade changes, then you'll be sent to colposcopy. If you've got high-grade cell changes, you'll be sent to colposcopy. If you've got human papillomavirus, HPV, detected, but no cell changes, you'll be called back in a year. If you get called back 3 times after a year each time, then you'll be sent to colposcopy, because it just means that there's HPV there, no cell changes, but your body isn't getting rid of the HPV. so then you'll be sent to colposcopy. If you get HPV and cell changes, you'll be sent to colposcopy. So you can see it's complex, so I will put a table with that at the end. So what is this colposcopy that I keep mentioning? So it's a test that's done in hospital. It takes about 15 to 20 minutes and it's done in exactly the same way as the original screening. So with a speculum looking at your cervix. The only difference is that this time we use a special light with a microscope to just look at the area in much greater detail than I can see when I'm just looking with my human eye. Special liquids get applied to the cervix which can highlight any areas that are abnormal because abnormal cells take up those liquids in a different way. And if needed, treatment can be done there and then, or a biopsy can be taken. So if the person who's doing the colposcopy can see from the various tests that they do that there are obviously abnormal cells that they can notice, then they will treat you immediately there. The most common treatment is called a large loop excision of the transformation zone. Short, it's called LETZ, L-L-E-T-Z, LETZ. And that's just done with a local anaesthetic which is injected into the cervix so you don't feel it, so you don't have to worry about that. It's also called loop diathermy, loop cone, loop biopsy, loop excision. So all of those things are a local treatment which will get rid of the cells there and then when you're in the hospital, and that's done. If there's a bigger area of cells or deeper, then you'll have what's called a cone biopsy, but that won't be done on the day. That needs to be done under a general anaesthetic. There are other treatments as well if the area of cells that are noticed as abnormal is very small. So you can have laser, which just destroys the abnormal cells. You can have cryotherapy, which freezes the area, and here the area would have to be quite small. You can have cold coagulation, which ironically is a heat source, even though it's called cold coagulation, which is used to burn away the abnormal cells. And if the area of cells is really big, invading other structures, going deeper into the cervix or even the womb, if you're past childbearing age, if you've decided that you've completed your family, or there's just no option because the changes are too big and the cancer is visible and established, then you'll be offered a hysterectomy to take away the womb and the cervix, and then obviously all of the cancer cells with it. But that's obviously quite radical treatment, and that's usually not what happens because the screening system catches people early, and the earlier we catch cancer cells always, the easier and simpler the treatment is and a complete cure obtained. So that's why it's really important to go for your screening every 3 or 5 years. Now, the HPV vaccine is something I'm being asked about a lot, and obviously I've done a blog on this, so you can pop over and watch that one too, especially if you have daughters in the 11 to 14 bracket, which is where we are giving that vaccine at school. We're hoping that the HPV vaccine will wipe out most cervical cancer. So we'll be screening and nothing will be showing, or very little. So please have your daughters and your sons vaccinated against this virus. It's simple, it's effective and it's proven safe. And I will answer all of those questions in the HPV vaccine vlog, so please have a look if you're worried. Australia have just announced that they can foresee a time when they won't have cervical cancer in big enough numbers to count. And that's fantastic news, and that's because of the HPV vaccine. So I'm going to put a link to that story in Australia in the description afterwards as well. So you've got lots to look at this week. So what's my take-home message? It's really simple. Please, please go and have your cervical screening. It's 10 minutes of what you might consider embarrassing and possibly a slight discomfort to save your life, and it does save lives. If you haven't been called by 25, please speak to your GP. So if you haven't got a letter, speak to your GP. If you missed your screening because you didn't want to go, that's okay as well. As I've said, I've done it. So you no longer have a letter and you're worried that you can't get it because you've missed it, you can. So you don't need the letter. If you know that you're over your 3 years or you're over 25 and you've never had a screen, then just contact your GP. They will have notification that you need Cervical Screening, and they will do the test for you. You don't need the letter. We get, as GPs, notices on our system telling us when a woman is due for her screening. So that's important. If you're peri or menopausal, for whatever reason, at whatever age, we know that women as young as 20 go through premature ovarian failure and have menopausal symptoms. If this is you and you find that your vaginal dryness makes it too uncomfortable, please speak to your GP. They will give you vaginal estrogen for 4 weeks before the test, and that will make it completely normal again. Vaginal estrogen works really quickly and really well. So that's another tip for my take-home messages, and back to get your children vaccinated, because we would love to see this disease eradicated in the future, and we do have that as a prospect. So I hope that's really helped, and I hope I've stressed how important cervical screening is, how at the moment numbers are dropping and we want to get them back up, and how it does save lives. Thanks for watching as always, and I really appreciate your support. Topics coming up in the future that I'm going to cover are tongue tie in babies. Should we be cutting them or not? It's controversial. Sciatica, what it is and how to treat it. Painful periods, there are solutions out there. So if you have a topic that you want me to cover, just suggest it in the comments afterwards and I will always cover it. So bye for now and have a great week.